All right, good morning. I think if everybody is ready, we'll offer a very warm welcome to our second annual Immuno-Hematology Symposium. I'm Kelly Walkovich. I'm a pediatric hematologist here at the University of Michigan, and I help coordinate with the rest of our team our Immuno-Hem program. So before we kick off with all of our great talks today, I just wanted to run through a few things about the program itself for those who aren't entirely familiar. So the clinic component of the program was established in January of 2012, and it really has many unique features. Primarily, the most unique aspect is its multidisciplinary nature. It actually has multiple services, as we'll see, ranging from genetics to pharmacy to hematology, infectious disease, bone marrow transplant, and even our A&I fellows. And the interesting thing about that is not necessarily that all those groups participate, but they actually all talk to each other in real time. And we actually have huddle time or circle time in our clinic based on our most difficult cases to talk through them. We have several areas of clinical focus. Immunodeficiency syndromes is a nice obvious one. Lymphoproliferative disorders that range from HLH and LCH to ALPS. Many of the neutrophil disorders, there's a stronghold for us based on the expertise from Dr. Larry Boxer. Or bone marrow failure syndromes, and then an area that we didn't exactly expect to get into, but more of the immune dysregulation and autoimmunity diseases have really become apparent in having a need for us, and so our clinic has become a home for many of those patients, putting us in touch with colleagues that we don't normally have a lot of contact with from neurology or endocrinology in some surprise areas of the hospital. We see quite a variety of diagnoses, so this clinic really has to have a strong knowledge base to go anywhere from your basic genetic disorders with Artemis deficiency all the way down to more psychosocial disorders as Gardner-Diamond. And while many of our patients try to help us out, whether it's typing on the computer and sorting out the woes of my chart or actually sort of directing our clinic area itself, we actually really need to rely, as I talked about, on those pieces of the puzzle all together, and everyone has a role to play between hematology, our transplanters, our infectious disease, genetics, A&I, and pharmacy, and it's really because of that interdisciplinary nature that we've had success in the clinic. And we really focus on teamwork between our patients and their families telling us the story, but also between ourselves. We treat most of the patients in Michigan with the majority of immune deficiency disorders, but we also really reach beyond Michigan, and this is just a representative map of where our patients have traveled from to receive care specifically here. And we pull not just from the Midwest, but from both coasts as well. And the goal of this symposium is really to help bridge the gap. You know, our clinic is booming, we see a lot of patients, and most of our patients and their families are really looking for the next step forward. You know, we can treat them with the medications we have, we can diagnose them in some ways, but we're really looking to bridge this gap for new diagnostics, new genetic diagnoses, and most importantly, more models of disease so we can figure out exactly what the underlying etiology is and how, importantly, to go back and attack that etiology and take it to our advantage to provide more cures. The symposium this morning was designed with that thought in mind to help bridge the gap. So we have a clinical component and a research component from the University of Michigan here in both avenues. The morning will cover the primary immune deficiencies and the importance of DNA integrity, as well as a nice review of the novel primary immune deficiencies in the past few months. We'll take a break for lunch and posters, and then we'll come right back with an afternoon session that really hones in on the heart of a hem-onc provider with the crossover between immunology and cancer. Have a session on immune dysregulation, and of course our awards area, where we have the Benjamin Liao Award, the best abstract presentation, and our keynote presentation. And I think no one really embodies the sort of bridging the gap between patient care and labs more so than Dr. Troy Torgerson, which we're very happy to have here from Seattle Children's Hospital as our keynote speaker. So if you're not able to stay for the entire day, please be sure to come back from 4:30 to 5:30 for his keynote talk involving STAT protein defects and immune deficiency, a rapid path to a big problem. We, of course, can't do this just as a standalone group of clinicians, so we have several acknowledgments to offer. We'd like to thank many of the sources of our funding between the Immunodeficiency Foundation, the St. Baldrick's Foundation, the Charles Woodson Pediatric Discovery Grant, Horizon Pharma, Underground Printing, and then many of our families who have been inspired by the care they've received within our clinic to actually donate back. So the Coven Family Research Fund, and then the Liao, Warren, Frew, Boxer, Ebens, and Finster families. Thank you very much for your help. We also have to offer a lot of acknowledgement to our families who act as teachers for not just us, but also our undergraduate, resident, and fellow curriculum. Cole is featured here, has actually helped the newest generation of providers on this path by participating in the M1 sequence this year and telling his story of severe combined immune deficiency. And we have many clinical and research collaborators, both here at Michigan and then across the United States, that we're grateful for their help. Another thank you goes just to the planning committee. It takes a lot of effort to get all this through and logistically secured. So we thank Mark for leading the events, and then the rest of our Immuno-Hem group, and a special thank you to Colin Duckett, who is our reliable source for interaction with the scientific community here on campus. And a very, very special thank you to Ashley Shaver, who all of you know as the main link to the success of this symposium. Ramsey, if you're listening, we're quite sad that you managed to steal her away to Northwestern next year, but we know that you'll take very good care of her while she's there, and we will certainly miss her. And so I'd like to take just a moment to give a big round of applause for Ashley. A few housekeeping announcements. If you haven't already, please download the Immuno-Hematology Symposium app. It's easily obtained by simply typing in that phrase in the App Store or Google Play. Posters, if you haven't noticed them, are actually located in the room sort of across the hall, seminar A, B, and C. They should be hanging all day long. However, they will be manned by their presenting person, primarily during lunch and then during the break later in the day. Also, this area is so nice because no food or drink is ever allowed in here, so please help us comply with those rules of not bringing any food or beverage into this auditorium. You can have food just outside the door in the more lobby area and in the seminar rooms. If you're looking for the restroom, those are located out this door, turn left, and they'll be on your right. And if you're looking for CME credit, don't forget to sign up for your 2.25 credits through the mechanism that Ashley provided. And as we think about our patients, we see a lot of happy smiles and a lot of happy faces between the kids and the parents and sort of our interactions, that they really become closely entwined with our group. But sometimes we're left feeling a little sad or a little bummed because we don't know all the answers and we're not able to solve quite yet all of the problems. But our clinic has really served as a refuge for hope. We have patients that are literally day of life 1 all the way up through age 67 in our clinic, and many adults actually come for a consult in our clinic, and their primary goal is to really find out more. And I think this symposium is really a step in that direction to help link the clinical problems that we identify with research folks here on campus or elsewhere to try to solve some of these mechanistic issues. And most of all, we hope that you enjoy the symposium. We're not actually handing out suckers, but we hope that you enjoy the symposium just as much as Luciana enjoys getting her little treats in clinic. So without any further ado, I think we'll go ahead and kick off the first session. So David, if you don't mind stepping up. David is our pharmacist who is highly integral to the success of our program.